Hi, I'm Dr. Seth Force. I am the Kamal A. Mansour Professor of Surgery and Chief of Thoracic Surgery at Emory University Hospital in Atlanta, Georgia. So when we get scans, we often see a solitary lung nodule, but then at other times we can see multiple lung nodules in patients who get CT scans. And the key thing there is to determine a few things. Number one, are any of them cancer? Are all of them cancer? Could one be cancer and the other be benign or non-cancerous lesions? Are they synchronous primary lung cancers, or what we call multifocal lung cancer, or is it a lung cancer that has spread or metastasized? It can be a difficult thing to determine. So first of all, in a lot of the multifocal cancers, we may see nodules that are different stages. So example, we might see a solid nodule, and then in other areas of that lung or the other lung, what are called ground glass opacities. So ground glass opacities are hazy, non-dense findings on CT scans that may represent early or non or minimally invasive lung cancers. And you can think of those as the beginning kind of seed in the pathway of a cancer forming and becoming a larger or invasive cancer. So clearly, if you see these ground glass opacities in conjunction with a solid nodule, those are not representing metastatic disease. And if they are cancer, they are separate early lung cancers. I tell patients, you can think of it this way: when people get skin cancer, they rarely get one skin cancer in their entire lifetime. They may have one on their arm, one on their nose, one on their forehead. Well, the same thing with lung cancers. If you've smoked for a long period of time, you've exposed all of your lungs to the chemicals in the cigarettes, all the parts of your lungs. And so then you're at risk for getting not just one lung cancer, in your lifetime, or even when you present, but multiple. We have to also look at the size of the lesion. So if someone presents with a very large lung nodule that's proven to be a cancer, if there's other findings of spread or metastases like enlarged lymph nodes, then we get a little bit more concerned that other lung nodules may be spread or metastatic disease. But it's unfortunately, it's not uncommon that I've encountered patients who were sent to me and were diagnosed with advanced stage or stage 4 lung cancer when they had a solitary lung nodule in one part of one lung and then a solitary lung nodule in the other lung, and they were told they had metastatic cancer. And oftentimes when we biopsy these may not even be the same type of cancers. So the two most common lung cancers are adenocarcinomas and squamous cell cancers. And I've had patients who've had one of each in each lung. Clearly that those are not spread, they're different histologies. So it requires a fair amount of workup, and some of it is clinical gestalt, as I call it, or just your clinical feeling. Does this look like a metastatic lesion or two separate lesions? And it's something you really have to kind of take time and think of, because you don't ever want to take a patient who's really stage 1 and call them stage 4, because then they're going to miss out on the correct treatment.